Thanks everybody, it's good to be here. Nice to see a few old faces. We're going to talk about an idea that we have for developing a wildlife health research centre at Roseworthy, and that's based on the One Health concept. So why do we need a wildlife health research centre? Well, disease has emerged more and more over the past few years, and we've noticed that there's been, from Kate Jones's paper in Nature in 2008, there's been a massive increase in the number of cases that have occurred, new emerging diseases. And we see that mostly it comes from animals, and 75% of those are coming from wildlife. So these zoonotic emerging infectious diseases has really reached its highest proportion in the last decade. So we have this background of lots more diseases that are occurring. Put that together with One Health, which is really a new worldwide strategy that's been developed to look at collaborations between, and really communications between the diseases associated with humans, domesticated animals, wildlife and the environment. And there's this One Health triad that we have here: healthy people, healthy environment, healthy animals. And it's a concept of trying to look at things in a slightly more holistic way rather than being in silos. So we do have a few emerging diseases in Australian wildlife. Hendra virus has become an issue since 1994, particularly in New South Wales and Queensland, where the virus is carried by bats, spills over into horses, and then that can then spill over into humans as well. So there's been several people that have died of this Hendra virus infection. We've got Australian bat lyssavirus as well, which is a newly emerged lyssavirus, which is very similar to rabies, seen in microbats and megabats, and there's 3 people that have died due to bat lyssavirus in Australia. We've got chlamydiosis, like Tash has just been talking about, with some really severe clinical signs, not so much in South Australia as yet, but maybe in the future, we don't know. The koala retrovirus, like we're talking about, and the mange. We've also seen cases of tuberculosis in seals, which is an unusual thing. Mycobacterium pinnipedia is very similar to Mycobacterium tuberculosis, and that's been seen in South Australia for the first time. We've seen chytridiomycosis in new species of frogs that are seen in South Australia, which is a paper that's coming out quite soon. And we've seen cases of cetacean morbillivirus, which is a die-off that's occurred in both, can occur in dolphins as well as seals. Whales. Beak and feather disease is also a big problem, and we see quite high levels of beak and feather disease. You can see a case here in a cockatoo up in Mylor just recently. Still flying, God knows how. And devil facial tumour disease, of course, we don't see that over here, but it has become a big problem, and certainly South Australia is playing its part in trying to look after insurance populations. So I'll just give you a quick couple of examples of some diseases that we've investigated. So the mass dolphin mortalities in the Gulf of St Vincent and Spencer Gulf in 2013. There was high numbers of dolphins that were seen reported stranded and diseased in that Spencer Gulf area. And we looked at the disease with the South Australian Museum as well, who were doing post-mortems at the same time, and came up with this new morbillivirus, this new disease that's been seen in South Australia for the first time. And it's a major cause of dolphin mortalities, particularly in several parts of the world, and it was the first time we'd kind of seen it in South Australia. And what we get with that is a kind of pneumonia, and sort of associated with it, with a morbillivirus, it tends to be a virus infection, so therefore you get often other diseases that might affect that animal as well. So associated with that, we're seeing fungal and parasitic pneumonias, and even systemic toxoplasmosis in some dolphins, which is unusual in the fact that toxoplasmosis is really transmitted by cats. So we're not too sure how that pathogenesis has occurred. Another example has been looking at the habitat degradation of wombats in the Murraylands, We looked into the research of hair loss and weakness and death in some of the southern hairy-nosed wombats in the Murraylands. And we were kind of alerted to this, and we investigated this kind of a few years ago now. And we found that a lot of these animals were really starving, and they were living in a really degraded habitat. This is wall-to-wall onion weed near Blanchetown, and that you've got a burrow there where the wombat lives, and all it sees is onion weed instead of Mitchell grass. And so in these areas there was diseases. A lot of these animals were affected to this sort of extent, and that was because they were actually eating some alkaloids which were in some of the weeds, and that's some of the wombats. And this is due to potato weed. So this is kind of